So ears that are big ears,
Yes.
you call it otoplasty.
That's correct.
Tell me about that. I mean, who comes in for that?
So usually there's two categories of patients that are getting otoplasty done, right? Usually the child that's coming in that's starting grade school, and there's the concern that the parent has that they're going to be mocked because of their appearance.
Big ear. How young could they be? Sorry to interrupt, but how young can they be
to have procedure done?
Yeah.
Usually by age 5 or 6, the ear has matured to most of its adult size, and you don't have to worry about stunning the growth of the ear by doing surgery on it at that point. A lot of times, though, I'll see patients come in, particularly women, and it's right around their wedding. Okay.
All right.
And it's because they've always had this problem, but they really would like to, at their wedding, be able to wear their hair up. And I did 3 people just recently, all the same reason. Okay.
How easy is it for you as a surgeon to do this? I mean, is this fairly routine? Like it takes you a half an hour, it takes you an hour?
Yeah, I would say, an otoplasty will take you about an hour and a half to do. But I like to do my otoplasties in a certain order, and I look for certain things. Most of the time what happens is that patients don't have this portion of the ear developed. So what happens is their ear flips out like this, okay?
All right.
So what I have to do is I have to recreate what we call the antihelical fold. That's what takes this and brings it back.
All right.
The second thing is that this right here is known as the conchal bowl. In some patients, it's really overdeveloped, so the ear is doing this. So you got to reduce that, okay? So once you've taken care of those 2 things, the vast majority of patients will have a really nice result. Now, sometimes patients have what I call the kickstand earlobe, that no matter what you do, the earlobe is just kicked out like this. And there's nothing more frustrating than having an ear tucked back nicely and having this earlobe sticking out. Basically, not to get too technical.
So you could fix that too?
Yes, yes. There's a piece of cartilage that runs down at base here called the claudia helicis. And what it is it's sticking out too much. So what you do is you dissect it, you put a little suture in it, and the earlobe comes back really nice.
So this is one of those things. I mean, speaking to parents for a moment, and my son, I told you, had this, but everybody was making like Dumbo jokes and big ear jokes.
It's crazy.
Not necessarily the Dumbo jokes to him, but I've heard it because I've been on a few school trips and they're brutal to kids. So what do you say to parents? How do they know if their kid is really being bothered by their ears?
Ask them. Just say, or try, when you're out at maybe a sporting event with your son or daughter at school, or you're at a party or something like that with your son or daughter, try and listen to the rhetoric that's going on. Secondly, kids, will sometimes say, well, mommy, I kind of like to have my hair longer cut. Let's not cut it so short.
Because they want to cover their ears.
Because you're covering your ears, right? So that's a cue that, well, this may be something that's bothering this person. So,
what about downtime? So you take a 10-year-old, 8-year-old, maybe during the summer.
It's quick. It's quick. I mean, we take the dressing off the next day, and I have them wear a headband for a week around their ears just to keep it back.
24 hours a day?
Yes, if they can, and then for the next 2 weeks after that, after the sutures come out, they wear it at bedtime, and then that's it. So it's a very, very straightforward procedure.
So never too young or too old? I mean, over the age of 5, but you could be, people are doing this in their 60s?
The oldest patient I did a otoplasty on was a woman in her 70s.
So if you don't like your ears, do something about it.
Sure. Why not?
You've done a lot of them.
Yes, absolutely.
Do you believe you should go to an ear, nose, and throat trained facial plastic surgeon?
I'm a little partial towards that.
Okay, good.